about, which I think it's very important for learning, but also as a protocol or guidelines for MUHAS research. And this is not only MUHAS, or worldwide now, plagiarism is unethical and should not be a conduct during your research work. So this is the area I'm going to target for the second part. So I think I shared the document for MUHAS guideline for dissertations proposal, and I'm just going to clarify more through the same guideline. More important, we need to remember the anatomy. The first one is the cover page. There's key things we need to consider in the cover page. The first, the institutional name and logo. That's very important. Muhimbili University of Health and Allied Science, at least the institutions and department. Some they add the school, some they add college, it's okay. But the key component should be the institutional name, department name, and the logo. You could look on your previous people how they structured. It's okay to add others, but please don't forget the department and the institutions. And that should be the top cover, the top sections of the cover page. The title should be precise and pretty much with the broad objectives. So the broad objective usually we write to determine blah, 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 blah. So with the title, you just omitted the word to determine or to evaluate or to assess. The remaining should be exactly as what in the titles. And among the common pitfalls we get from reviewers, it's when the title, the objective is not reflected on the titles. So to avoid this, please copy exactly what your broad objective is. Omit the first few words to determine to what, and the remaining should be part of the title. So title should reflect the broad objectives. The name of the principal investigator, which is you, is very important with your supervisors. And that should be another part of your cover. But also, we need to see when was this done. So at least a year of that proposal. And probably we focus on the year of submissions. So if you plan to submit your proposal maybe 2027, so the year and date should reflect that one. And that comes from your timeline. One of the sections in your dissertation is timeline. And in the timeline, you know when will be exactly estimated date of submission. And that's what should reflect on the title page. The last part of year and date, not much important to the proposal, but your final report, this has to be there. We can allow omission in the proposal, but the final report, a date and year has to be there. This is very important on the cover page. Table of contents, this is pretty much straightforward and probably not much to discuss now. We all know what table content means, but maybe one word to say on this, use a software, not manually, the table of contents. The good thing with the Microsoft Word, there's a section where you could create a table of contents, and this is what we wish to see, not writing manually. There's a technical terms we'll be using in your dissertations, very important. There's a list of abbreviations. There's common mistake done from residents when they write the list of abbreviations. There's a rule of thumb when to write your list of abbreviations. And the rule of thumb is follow alphabetical order. So list all your abbreviations. List all abbreviations written in your proposal, and then arrange them in the alphabetical order. And if you have more than one word with a similar first letter, use the second letter to differentiate which one comes first, which one go last. And if you have more than two words or three or four words, so you use, if they share the common first word, use the second letter to differentiate. If they share the first and second letter, use the third letter to differentiate. So as you can arrange them according to alphabetical order. This is very important. We do see this commonly from reviewers asking residents to correct the list of abbreviation simply because they didn't follow the alphabetical orders. Sorry, there's something to correct on my part. Okay. What is now? Right. So that is part of the list of abbreviation, follow alphabetical order. And in your writing, this is on the list of abbreviation, but this abbreviation, when you use in the main text, the first time when you use that word, write a full name, full expression with the abbreviation in the brackets. In the subsequent appearance of that word, only use abbreviations, not writing again the full weight of that abbreviations. I repeat, in your main text, if this word is mentioned in the list of abbreviation, the first time to appear in your write-up, whether in the background or in the methodology or on the data collection, as long as the first time to appear, you need to write a full word, a full term, plus abbreviation in the bracket. In the subsequent appearance, you don't need to write a full word, only write the abbreviations. This is the rule of how to use abbreviation in the writings. It's very important to stick to these rules. When it comes to definition of terms, it's another glossary sections among the first sections of your write-up. So please don't write an textbook definition of that word. For example, let's say you write emergency medicine. Excuse me. So this, it's a common word, doesn't need to appear in the definition of terms. We don't need the common words. We use mainly the technical words which we use in our study, and probably it's altered from the common definition. For example, if you use the word pediatric in your proposal or children, we need to define who are these children. And this is based on the age. We don't have a common standard of a children. Some they say 5 years, some facilities up to 10 years, some up to 14 years. So write the definition, we call it operational definition, according to your study. Who is the children? So we expect the definition of terms should be operational, the definition which apply to your study, not the standard definitions. I give an example like that children that it's been used differently from your research. That different definitions of that word, that's what we need to see in the definition of terms, but not the English definition, not the common definitions. If let's say you use mortality or morbidity, what does morbidity mean according to your study? How did you define it? How did you apply the word morbidity according to your study? And that is what we, if it's just use the common words, it doesn't need to appear in the definition of terms. This is very important. And the other area also, probably you need to consider to define your outcome of interest. We don't know what your outcome is. If it's length of stay, what does length of stay mean in your study? Maybe 2 days. If patients stay more than 2 days, according to your study, that is a definition of length of stay. That has to appear because somebody else could mean 1 week. Somebody else could mean just 24 hours. So when we talk about definition of terms, should be operational definition, which means that meaningful of your study. And the essence of this to have a common understanding between you, PI, and your readers. And that's as we write definition of terms. Zile common terms, even the readers knows hata kama usipoandika definition. So don't repeat the common words. Only operational definition, that's what you need to apply to your study. So that was part of the glossary. When it comes to abstract, abstract is another technical area. We should know how to write it and write it correctly. With the proposal, abstract, we call it a BOMB format, BOMB. That should be the at least a minimal component of your abstract. Some they use IMRAD mnemonic, it's okay. Some they use bomb, it's okay, but all they contain the same. So at least you should write a summary of your background. You should write your objective, broad objectives, not the specific objectives, a summary of your methods, and summary of your budget. Budget could be one word. This study will require 2 million Tanzanian shillings. It doesn't need justifications on the abstract. So if abstract meets these four core sections, it's not complete. And we don't need more than that. And we don't need more than one page with the abstracts. Some, and this we'll see in the manuscript, they have restricted to the number of words. But for MUHAS, probably at least should be one page, but include a summary of at least these 4 sections. That's what we'll include in your abstract. When it comes to introduction sections, introduction is a bit broad. Introduction includes your background, it's a part of introductions, your problem statement, your rationale, conceptual framework, and literature review. These are also part of the introduction. Some they consider literature review is another part of the work, but some they consider is a part of introduction. So the bigger term will be the abstract, introduction, methods. Introduction contain all of these subsections within. So be considerate including all of these sections, and I will go through one after another. In the introductory part of your abstract, or basically what need to be in your abstract. Sorry, at least it should include, not the abstract, sorry, the background. So what I need to know, if I read your background, I should be able to understand why the importance of this study. It should include a summary of keywords which at the end nielewe hii study na umuhimu gani na kwa nini unahitaji kufanya hiyo study. So it should not be more than 2 pages as a background. More background inakuwa imepoteza maana. So at least it should include the burden of that problems. Let's say if you study about the prevalence or the incident of fever or eye injury among children, we need to see from your initial understanding, and background comes from your own conceptualization of that idea. We need to see how big the problem is, because common in rare issues, why should you do study on that? So at least show us the magnitude, and you're allowed to cite some literature on this or previous study. Or if you don't know previous study, you could even go do some survey kwenye eneo lililopo ukajua tu magnitude ya tatizo likoje. And this should at least explain the magnitude in terms of number of ukubwa hilo tatizo, but also severity, or even the outcome. If it's bad outcome, then we need to explain kwenye hiyo the burden of that. So burden could mean many things around that ideas. But also you need to tell us what it's known. For sure, there's no study ambayo unaweza ukaifanya haijawahi kufanyika kitu kingine chochote. But we need to see what has been done around that area. So you could see maybe if it's the example I give you, incidents of eye injury among children, and you could decide that like maybe so and so have done this and this is what's been shown. Why we want to know what is happened? Because we need to establish what is missing. So the component of burden, what is known and what is missing, this is what will compromise your background. So as, I can see now, this study is going to address this gap because so many has been done around this area with this magnitude. But this one key component is important to know related to this and has never been done before. That becomes your justification to do this study. So at least I need to see you have described the burden or magnitude of that problem, what has been done and what is missing. That is missing, that is what is going to develop your objectives to address the missing gap or to address the gap of that study. So that's all about the background. Problem statement, I think this is probably the most areas which you have done. more or less similar to the last section of your background. Again, you need to explain the magnitude of the problem, what factors has been established, or what you think factors lead to the problem you see in your context of your study area. But also more important with the problem statement, we need to see clearly what is missing, what is the gap. So basically, when I write this, I usually start with the title. And once I have the title, I write the gap, the problem. And then I have to write the rationale. A summary of this problem statement and rationale need to appear in the background. Because in the background, we need to know what is known, we need to know also what is missing, which is coming from the problem statement, and the importance from the rationale. So the problem statement at least you should consider the magnitude, what factors lead to that, but also what the important gaps, so as your study is going to address. We don't really study which is not going to answer a scientific problem, a scientific questions. You must establish first, we must establish the gap before designing a study. You need to realize or to identify the gap so as you design the study to address or to answer the gap, the missing information in the body of knowledge, right? There's a section for conceptual framework. It's nothing just in the interaction of your variables, the independent variable and the dependent variable. How do they link each other? How do they interact each other to have impact or to have caused the magnitude? Or how can we interact your variable to have the answers of the gap we created? So basically what you need to draw is schematic presentations of the variables and how they link each other to the outcome of interest. So we need to see whether age or comorbid, or depends on the research question you made or the titles, the factors, the variable which lead into the outcome of interest you're going to do. This is what basically the sketch to your conceptual framework. And it's not only the diagram, you need to write at least a paragraph explanations of that sketch. Some people, they just sketch the conceptual framework and they don't give explanations. If you copy it from somewhere, you must cite the source of that conceptual framework. But if you design yourself, you also have to explain that this is what just made and give the explanations to the conceptual framework. But no proposal will be complete without a conceptual framework. If I see your conceptual framework, I must understand which variable are you going to collect and how do they link into each other to the outcome of interest which you're going to get as a result. Please don't forget to mention the confounders, the variable which you think might affect your outcome of interest. Why are we interested to see confounders? Because also we need to be sure that you're aware of a certain information might alter your results so as you could take appropriate mitigation measures. So if possible, your conceptual framework should include your variable of interest to the outcome, but also potential confounders which might affect the results, your outcome of interest. That's all about conceptual framework. So this is just a summary of part of the introductions. We talk about the background, we talk about the problem statement, we talk about conceptual framework. I didn't mention about rationale. I think rationale goes without saying. It's just explanation of how this study is going to answer the gap. What benefit are we going to get from the outcome of this study? That is all the rationale. So it's just to explain the results of this study is going to help on 1, 2, 3, 4, 5. That's all about the rationale. But the background problem rationale has to tie each other so as we could have a concept for understanding of your study. That's all about the background. Let me proceed with the second sections. Maybe I will take the answers at the end, or I'll take the question at the end of these sections. With the methodology, there's key areas we need to consider when we write our methodology. And people, they do mistakes sometimes not to include them in your write-up. Method has to be comprehensive. This is the section ambayo we call it like a moyo of research. If your method is not well written, we assume the results will be frauded because you can't get results without a good, proper method. But also, method should be written in a way, should be very expressive, in a way that if Rolly, you write your proposal, you give it to me. When I read your method, I should be able to conduct a similar, exactly the way you wished this study to be done. So it should be expressive. Write every section in detail so as somebody can replicate this study. And this is what we want in the method sections. Don't assume somebody will understand this. So every term, make it clear, crystal clear, so that it can be replicated. That is the benchmark how we read on the method sections. So with the study design, we need to see what design of this study. Is it a cross-sectional or longitudinal study? And we know the difference between cross-sectional and cohort. Cross-sectional means no follow-up. You go one time, collect data, and go. You don't need to come back again to see what the outcome or what the results happen after this. No follow-up at all. That's what we call a cross-sectional design. But a cohort or longitudinal, we collect data now, and then we'll come back maybe 24 hours or 7 days or a year to come and look back in outcome or the results of that initial information. So that data collection is not be done at one point. It will be on the follow-up. And that's what we call a cohort or a longitudinal study. So clearly you must state your study whether it's cross-sectional or longitudinal study. But also you must tell us whether it's prospective or retrospective study. It's very important for us to understand how do you get this data because we understand limitation of each. And more important, how we take care of these limitations for each design. But more important, is it descriptive or analytical? Some people, they get confused on this. Descriptive, most of the observational study we do, we don't intervene. We don't introduce any intervention to look for the outcome. We just describe what we see. This is a descriptive study. And I can tell most of the residents or their dissertation is just a descriptive study. Analytical is the one which will have a question, need a complex mathematical analysis to come analyze. Yes, we have initial information we inject to the populations or we inject to the study. We chakata this information to come up, we expect to change the results of. So most of the interventional study, for example, becomes analytical. But I guess we all going to do descriptive study. Things like randomized control trial, these are analytical study, not a descriptive, because we do some intervention in it. So I expect your design should complete maybe this is prospective, cross-sectional descriptive study. Must meet all three parts of the design as one sentence of your study design. You must also describe the study area. Now, there's a very huge problem in the study area description we see from the previous residents on their dissertations. People, they do copy and paste because if they study done at EMD at Muhimbili, they assume the information will be the same. So they copy from previous study and they paste. And most of the right Muhimbili National Hospital has a bed, Miamoja Amsinis, has a staff. No. The study area should be in relation to your study design. I mean, your study titles, your study research questions. If you're doing study on maybe critical ill, management of critical ill patients, to critical illness. We need to see how many patients have been seen in research area or what is the critical ill patient, how do they manage, who manage them, what are the resources you have. At the end of the day, when I read your description of the study area, I need to you want will be able to get. You can't conduct a study of critical illness and then ukienda kufanyia OPD. For sure, you'll not be able to get this information. So it should justify the availability of your data of variables ambazo umeziandika kwenye conceptual framework au kwenye specific objectives. Kama unataka kustudy sijui availability of bedside diagnostic test. Kwa hiyo kwenye study area tuelezee kwa sasa hivi kama ni Muhimbili wana diagnostic bedside diagnostic tests zipi. So you could say the EMD has a number of bedside tests, they have ECG machine, they have point of care, ABG machine, they have glucose, they have what they can check this. So tupe picture ya lile eneo ambalo unaloenda kucollect data in relation to your variables. Don't mention variables ambazo huzihitaji au huwezi kuzicorrect, hazisaidii chochote. We need to get the picture of what you're going to collect of that sub-area. So, sio kwamba ni za kufeki, describe exactly what they have. For example, if you describe EMD and you describe maybe management of critical ill patients. To manage critical ill patients, you need personnel. So describe the department, who is there, who is doing the management. We have nurses, what expertise they have. Maybe nurse specialists, we have nurse interns, we have blah, blah, blah. But also the department is staffed by resident, registrar, emergency medicine specialists, if you have critical specialists. That is what we need to get a picture of your study area so as I can justify, in this area, the study population is there, and this variable is going to collect according to this study area, anaweza kuipata. Don't copy the number of beds unnecessarily. So that's all about the study area. Very important sections. Another part of which people they get confused regarding the populations and including the inclusion and exclusion criteria. So the study population is the one ambao meet your inclusions, but also, yes, especially with those they meet inclusion criteria. Kama una study critical ill patients, we need to know by definition who are these critical ill patients. Again, I expect critical ill patients umeiweka kule kwenye definition of terms kwa sababu they can be defined differently from different studies. So this is one of the operational definition we expect to see on the definition of terms. So you're going to study critical ill patients. How do we identify the critical ill patients? That is your inclusion criteria. So critical ill patients, all patients who 80 years or maybe it's critical adult patients. All patients who are 18 years and above, maybe triage as a red in emergency department. So we understand, so when you say critically ill patients, according to your study, it's an adult, 18 years and above, lakini kwenye triage wamekuwa identified as a red category. Or you could say critically ill patients, all patients who triage in resus, regardless of the age. Kwa tunajua, kwako wewe, the definition of critical ill, ambao ndo inclusion yako, wote waliokuwa triage wakapelekwa resus, they are critically ill. And no wrong or right answers to your definition of terms. Wewe ambaye ni PI, that's the one you define who is your study population. Kwa inclusion, ni zile criteria unazoziweka za kudefine the study populations. Adult or children less than 5 years ambao wamekuwa triage as a green. This is what our study populations. Or it's adult who is diabetic ambao wamekuja in DKA. So we expect huwezi ukamuenroll you study mpaka amemiti hivi vyote. Kama umesema awe kwenye DKA, maanake umeshafanya test na umeconfirm is a DKA patients. So study population should be defined with inclusion criteria. So when we talk about exclusion, study exclusion, it's not the opposite of the inclusion. Uwezo ukatuambia kama study inclusion yako ni adult triage to resus, alafu kwenye exclusion ukasema those not triage to resus. That's not exclusion. I always give simple examples on inclusion and exclusions. You can't exclude something which you have never included. Exclusion means tayari ulishawa include, kwa walimiti all the inclusion criteria, but for some reason you are not able to analyze them. So these are the one we'll exclude. So you need to set a potential criteria ambazo zinaweza zikakufanya, although your study population may meet all inclusion, but for some reason will not be part of the analysis. For example, missing informations. That can be an exclusion criteria. Kwamba you might be enrolling adult, diabetic, trade to research about the differentiation zako, lakini wakati wa management certain information hazipo, of which ukimwanalyze huyu atakuwa ameleta bias kwa sababu there is a missing information. Kwa hiyo your exclusion criteria must come from those already included. And this criteria maana yake tuna exclude kwa nini? Tukizi include with this missing or with these criteria ambazo tunawaondoa watakuja kuleta bias. For example, if you're studying a populations based on the D-dimer, let's say you study PE patients based on D-dimer, unaweza ukasema nita exclude let's say septic patients. Kwa sababu gani? Septic patient pia wataleta raise D-dimer. Kwa hiyo tunaweza tukaanalyze as a PE, kumbe kwa sababu D-dimer imeraise sababu ya sepsis au sababu ya being pregnant. So I'll exclude septic patient, I'll exclude pregnant patients kwa sababu they will have variables ambazo zitasababisha bias kwenye data zangu. Kwa hiyo please set the exclusion within those population who meet the inclusion. Don't negate the inclusions. I think that, I hope it's clear, and we're not going to see that confusions from your write-up again. Okay, time is running up. Also, simple things like timeline, we need to see each section of your part of the work. Proposal, lini utasubmit for ERB, lini utasubmit, utaanza data collection, lini utafanya analysis, lini utaandika report. The projected timelines need to appear as a sections on your method sections. Sampling, this is another area also we need to understand clearly. There is so much confusion regarding a sampling, a sample size and sampling technique. I'm not going to focus much about sample size because there's another sessions that will talk into detail. But let me explain the sampling technique. A good study is the study which include all population of interest. If you can study all children coming to EMD, that would be the best study ever you could do. But because of the either sometimes time constraint, financial constraint, or logistics, we might not be able to study all the populations. So we need to take a sample from the bigger populations. This is all the time you need a sampling technique. If you study the whole population, you don't need a sampling technique. You just describe will include all patients. But when you say we'll do sampling, means you take some out of many. So let's be clear on this. For example, somebody could design a study, maybe a retrospective study, and we collect all patients from the past, maybe 2 or 3 years. As long as you say we'll include all patients within 2 years, which meet the inclusion, we don't do sampling at this point. But because we only want 40 patients out of all patients who've seen in the last 2 years, maybe in the last 2 years we have 2,000 patients, but our sample size is only 40 patients. So how do we select 40 out of 2,000? That is where we need a sampling technique, which there are many. Could be a random sampling, just tossing the coin. Could be systematic, that maybe you list the name and then maybe you pick every 10th patients. That is systematic sampling. Or sometimes we use a random table, and nowadays there's so many computerized system where you could systematically select a sampling as a sampling technique. So it depends on your design. If you're taking them all, then you don't need to say this is a sampling technique. Sampling techniques only when you select few from many, and you need to explain how will you select them. That is what we call a sampling technique. And sometimes are you collecting them on consecutive basis? You might be taking a sample, but on consecutive patients, that every coming patient you'll be enrolling until you meet your sample size. Or sometimes you do it conveniently. By the time you come to shift, that's where you'll collect data. If you're out of the shift, the data is not collected. This is convenient. So also need to explain, if you do sampling technique, is it consecutive or is it convenient? It's important to explain that. And each has its own meaningful. So if you do convenient means there is a potential bias for this. But it's not research without potential bias, provided you know how to mitigate that. Still, people they collect data with the convenient sampling and it passed. As long as you justify why you had to do a convenient sampling and not consecutive sampling. Variable we have mentioned, we have dependent variable and independent variable. Independent are those variables who exist by its own. Those variables which patients come with, let's say age, sex, educations, marital status. These are independent variable, doesn't depend on the other things. The outcome variable, most of the time they are the dependent variable. Kwa sababu I need to see age akiingizwa kwenye machine what the outcome will be. So the outcome will depend on certain factors. This is what we call dependent variable. So most of the outcome they are dependent variable, and this initial information you collect from the demographic, from initial patient characteristics, these are independent. You need to list them on your proposal. But also, we have a primary and secondary outcome. Has to be appeared on your write-up. What are these primary and secondary outcomes? From your list of specific objectives, one specific objective, which is carrying the main idea of your research, this is the one we call a primary objectives, a primary outcome, sorry. The rest of the specific objectives, they are secondary outcomes. So we derive outcomes from your specific objectives. One among the 4 or 5 or 10, depends on how many specific objectives you have. One of them, which primarily carrying the ideas, is the main outcome of interest. This we term them primary outcome. It's you, PI, who decide which one among these is a primary outcome, which one is a secondary one. But should come from your specific objectives. And the outcome are the one which you're going to analyze. We'll have a table results from our outcomes, the primary and secondary. And then during the data collections, but more important data analysis, you need to explain how will you collect the data. And the explanation here, you need to explain as from the how do you reach the site, how do you screen the populations, where you go. For example, if you go to ED, maybe you're doing study in pediatric patients or you're doing study in diabetic adult patients. But when you go to ED, there's many patients. How do you identify potential diabetic, adult diabetic? Those are screening. It's just like the process of streamlining the huge population in your pool to a sample potential study populations. That is the screening. But how do you enroll them? Ukisha screen uka-identify potential study populations, unawezaje kumrecruit akaingia kwenye study? How do you assess the inclusion criteria? Na kusema okay, huyu amemeet, then utampa consent aweze kusign ili awe part of your study. This is what we call should be description of the study data collection methods. But how do you analyze using whether SPCS or Strata, or there's many software to analyze your data? You need to describe in your methods section as well. But your statistical inferential, we need also to see whether are you going to do logistic regression, are you going to do cross sections? How do you analyze continuous variable? How will you analyze categorical variable? Has to appear in your proposal as well. With how do you define the significant level? Is it 0.05? Is it 0.02? It's UPI, you decide on this. We need to see all of these descriptions on your method section. The last part, which I think is more important, is ethical sections. In the ethical, at least consider to include these few words. where do you get the ARB approval? Is it from MUHAS ARB? Is it from JKCI ARB? Is it from Mananyamara ARB? Or NIMRI? We need to see in your method sections, where do you expect to, or where will you submit for ARB? But also, once you get ARB, you need to collect data. Ethically, you need to get permission to collect data from the institution where you find your study population, but also permission from the patient themselves. I mean, the consent. So if you collect data at Muhimbili, so we need to expect a description of how will you get the permissions. So you need to write maybe permission to collect data will be sought from Muhimbili National Hospital administration. That statement is very important. So where will you get a ALB? How will you get the permissions? The consent, you should explain how do you seek the consent from these patients, or if your study doesn't need consent, you also have to explain. But also confidentiality is very important. How will you handle the data? Maybe the data will be handled by PI in computer encrypted password, blah, 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 blah. We need to see those statements kwenye ethical considerations. Investigation tools, more important here, we need both version, English and Swahili. But if you do observational and you have a checklist, we need to consider both questionnaire and a checklist. The difference here, questionnaire ni ile maswali ya kuoji, but a checklist ni wewe mwenyewe unachokiobserve kimefanyika au hakijafanyika. Those are a checklist. So it depends on your design of your study. How do you get the data? Are you going just using the questionnaire, or you need a checklist, or both? We need to see this in your study populations. It's more important always to proofread whether you have all required list of your proposal before you submit for ethical clearance. What I wanted to tell you, this is your foundational journey of being a scientist. Once you have your MMed, now you are a scientist. But how do you achieve to be a scientist? You need to do research. And this is your time to shine. Because we studying at MUHAS, your proposal will not pass if you don't follow MUHAS guidelines. I should tell you, different institutions, there are different guidelines of writing a proposal. I expect all you will submit your proposal to MUHAS ARB committee. Please follow strictly the guideline. What the guideline says, you do it that. Even our reviewers, usipoweka vipengele vyote, they will turn it back with these so many comments. So please don't omit any sections. Don't add your own sections. Kama section imepanga 1, 2, 3, follow all those as all needed and fill all the gap. So what I would advise, maybe from previous proposal, delete all detail of the section, leave the headings, and make sure you have to fill now the sections. Or if you go to the MUHAS website, there's guidelines of research proposal. Download it and then fill all the sections as required. This is how we could write a good research proposal. Let me stop here for the first part and hear from you if you have any question or clarifications from me or any contributions for this study. You're welcome. Just shout if you have any question or comments. Yes, Madam.
Yes, so Doctor, thank you very much for well elaborated introduction. I have two questions regarding to this part. The first is, if I believe following you up, I didn't get well on where does the research question and objective fall? Is it on the part of abstract or introduction? And the second question is, if we had, suppose I'm doing a research to a resident or to a doctors, to whom I'm very sure like they are very confident in English, should I also have the investigation tool in both language, like in English and Swahili? Or because my study population very keen in a study language, I should also just develop investigation tool in just one language?
Thank you, Madam. Regarding your first questions, if you follow, I just pick the most sections with errors, with mistakes. And that's what I presented. But that no means my presentation was comprehensive to the guidelines. As you could see clearly what you picked about, I didn't talk about research question, I didn't talk about the objective. These are section ambayo inajitegemea. Ukishatoka kwenye introductions, the coming sections inakuwa ni ya research questions and then followed by objective and then follow methods. I thought research question objective, they are straightforward, and that's why I didn't want to spend much on this. And by the way, kuna section tutakayozungumzia kule ambayo kwenye session zetu itazungumzia ile eneo. So yes, the section ambayo ina follow after your introductory part. But objective is not part of the introduction. It's another sections ambayo inaendana na, kwa sababu research question objective ni vitu ambavyo vinafanana. So it's a section within between your introductory part and the method. Regarding your second questions, don't be hero kwenye learning process. Even if you know you are a study participant, they are conversant in English. As a learning process, the guidelines want you to write both English and Swahili. Please write it. Ukishapata ethical clearance, huko utachagua unaenda kuitumia ipi. But as a learning process, you need to follow the procedure strictly. And that's what I said, follow the guidelines strictly. Don't be smart, don't try to be clever. Thank you. Any other questions? Omen, I did not clearly answer your question.
I have understand.
Okay. Any other questions or additional or clarifications?
Good morning, Dr. Said. I thank you for all the elaborations. I wanted to ask on the part of IRB. You mentioned that we can have, we should clearly state if we have requested IRB from MUHAS, JKCI, or NIMRI. I thought it is strictly IRB requested from MUHAS. So I didn't know there is option of getting IRB from JKCI or NIMRI. So I just wanted it to be clear. Is it optional that you can have IRB from JKCI as well or NIMRI, or it's only a MUHAS IRB?
As a resident, you've been taught by faculty from MUHAS, so please submit your dissertation for ERB at MUHAS, not somewhere else. I was just giving an example that ARB can be sought anywhere else, provided they have ethical board, validated ethical board to provide clearance. That's what I give an example. Probably as a faculty, you can submit anywhere else, but as a resident, please, we all geared to submit MUHAS ethical board.
Okay.
Hope it is well understood. That's my assumptions. And we can have 1-2 minutes, just a break, then we'll go to the second part of our presentation today. of our session today. It's all about plagiarism. Somebody could wonder why we're taking it seriously, even structured a talk on this, simply because of its consequences. And I can promise you it can affect you well as a resident, but if you don't understand it well, even on your career will affect you. So it's something really we need to take it. And as a resident, I've been a resident as well. This is somewhere which we take it lightly or we take it blindly. I don't wish to have that understanding. Let's respect the professionalism by avoiding plagiarism. How to avoid it, how to prevent it. And that's why we're going to have probably half an hour talk on this section. So, misconduct in research, especially academic research, it's coming from many areas. Unfortunately, because scientific work is being done, build up from the previous work, we can't avoid copying from other or referring from previous work. We always do that. But there's a rule to follow when you do that. The ideas, how you do your writing, how you structure. For example, we have a common structure for proposal. So every student will write in the same way. This is already plagiarism because we copy from previous guidelines. But there's a way how to mitigate this so as not to be a plagiarized work. How we design, sometimes we put images like what you said, your conceptual framework. You could copy a certain diagram from a previous study or previous work. It's okay provided you follow the rule when you use a picture or a diagram or something else from somewhere else. So the material predisposes us to plagiarism. But the actions, how do we do it? Sometimes we can modify, but sometimes we can do it as it is. Still can be done. But the worst part, if we do the 1 and 2 without citing, without adequate source referencing, this is what we call plagiarism. It's not like we're saying we should not copy somebody's idea or should not take somebody's conceptual drawings. You can do it. But if you do those without acknowledging the source, that is what we call plagiarism. So you just need to remember all the time when you're referring from somebody's work, from somewhere else, you need to cite, you need to acknowledge the source of that information. Otherwise, it's plagiarism. And sometimes we do it unknowingly because we don't know what plagiarism is. So plagiarism could come from different areas. There's what we call copy and paste plagiarism, or we call it direct plagiarism. I think this is clear to everyone that you blindly, and this is I could see how people they write a literature review. Most of the residents, they read different papers, they copy a certain sentence, they paste on their proposal. They pick another study, they copy a sentence, they paste on the proposal, and then they make a paragraph from this copied different sentence from different where. That is also plagiarism, right? Sometimes you copy and you alter the word. Maybe you alter the sequence or you mix up sentence from chapter A and chapter B and chapter C. You join the sentence, you think it's not a plagiarism. Still, what we call discussed plagiarism. But sometimes you copy somebody's work, you just change the language. Maybe it's written in Chinese and you are lucky you know Chinese. You convert it into English and you think it's not a plagiarism. Still, it's plagiarism. But sometimes you do it without knowing. Yeah? You have an external source, but you forget to cite. Just by omissions. Still, it's not excluding you from being plagiarized. paraphrasing. This is what we encourage. If you copy a sentence from a certain source, don't copy and paste as it is. You need to paraphrase. Read that sentence, write in your own words. It could mean exactly the same, but write in your own words. But even if you paraphrase, still it's plagiarized if not cited. So you could see plagiarism coming from different sources. And sometimes we do it without knowing. Always remember to acknowledge. This is all what we will ask at minimum. And this is how the scientific work is being done. Unfortunately, even your previous work, if you repeat it again and you want to produce it as another new things, it's still plagiarism. So let's be aware and know how to mitigate the impact of this. And some people could assume maybe undergraduate elective research can be produced as MEd and you copy it as it is. It's all been acknowledged or already been used previously. If you reproduce your undergrad work, still is plagiarism, even if it's your work. If you copy it from your colleagues' dissertations, it's plagiarism. And there's many. So the good thing that nowadays we have a software to detect the plagiarism. And this software is scanning all over the place, especially in academic activities. The postgraduate work, the undergraduate work, the report from different consultation work, but even the manuscript published from previous stuffs. These are all in the software. Once you use them, the software will detect it. So be keen to avoid plagiarism because it has very bad consequence as what we're going to study later. And we understand because we can't avoid copying from somebody's work because there is some words keep it repetitively. For example, the way Muhimbili University, for example, the Arabic sections. Every residence or every research we write, I will seek Arabic from Muhimbili Ethical Clearance Committee. That statement, even if you paraphrase, it will appear the same. Muhimbili Ethical Clearance Board. So plagiarism is not set at zero. We accept up to 30% as a MUHAS guideline. As what I said in the previous section, we have a software, each has to do self-assessment. If you get more than 30, then you need to rewrite or paraphrase your work to reduce the number of similarity index. Below 30, it's acceptable. But from single source, let's say MUHAS, also there is a certain words which appear in the MUHAS write-up, maybe MUHAS Arabic board or MUHAS activities. This is accepted up to, I think, 6%. I'm not sure if they reduced to 5%. Some they say 5%, some they say 6%. In the previous submissions, they allow us up to 6%. I think this was the previous guidelines. So these are MUHAS words ambazo ni zile ambazo tuwezi kuziavoid. Maybe title yako, kwenye title page kutakuwa na Muhimbili University of Health and Allied Sciences. Kutakuwa na emergency medicine department, of which previous residents, they write similar. So all of these will come from single source. We can accept up to 6% of this. But more important, try as much as to paraphrase and acknowledge the source. Why we insist not to plagiarize your work? Because of very bad consequence could happen. One, it will destroy your trust and reputations because of fundamental violation of academic integrity, and this will destroy your professional but also academic reputations. This is the easiest penalty, just to take away your trust. In worse situations, it can lead even the academic penalty, maybe to supplement your dissertations. If we really consider seriously your work has been plagiarized, you might be but in worst scenario, lead to terminations of your study, can be absconded from studies. Depends how severe the situation is. It's very important to consider all of this as a serious consequence for your dissertation. So it depends on the severity of plagiarism you made. Any of these actions can happen, and this will destroy your plan. It doesn't end up within your studies. The consequence of plagiarism can follow even after your graduations. You might be submitting your dissertation or your research work, maybe you publish your manuscript. 2, 5, 10 years down the line, we came to realize this work was plagiarized. Still, the penalty can fall. Yeah? I think this is the worst situation we could lead for you to plagiarize your work. And could lead maybe withdraw for your transcript or certificate if it's been found without doubt that you get it from your plagiarized work. So it has very bad consequence if you are not careful and if you look at easy way. So retraction of your published work, maybe sometimes you publish your work and it will be retracted from all your journals. Or you can be blacklisted and you will not be able to publish anymore from previous journals. If you maybe secure a grant and we came to realize you plagiarize your work in previously, the grant can be withdrawn. But also you can be, medical litigation could follow and can be sued if you are proven without doubt that you umeiba kazi ya mtu. So plagiarism has very bad consequence, and most of the time we look at easy way, which is dangerous. What you need to do, make sure you follow the guidelines. Before you submit any of your work, not only dissertation, any of your professional academic work, just check whether it doesn't really look like a plagiarism work. If you have access to software, use it to check whether your work is, especially the scientific submissions. Even if when you submit a presentation to conference, make sure you check it. Unaweza ukashangaa umesubmit presentation pale unapopresent mtu anaibuka kwamba oh, hii kazi ya kwangu nilifanyia somewhere else. What a shame is. So check if you, na sometimes ndo zile ambazo zinatokea unaware. Umecopy it somewhere au umeandika it the way kumbe mwingine alishaandika in similar way. So always have a habit to check. And that's what I said. Less than 30%, it's good to go. And from single source at 5% or 6%, it's okay. But also check on your bibliograph whether you've listed all the sources, whether you have referred, or you have a good reference for your sources. And the paraphrase sentence, whether has been done it well. That's also important to check. Yeah, this is how we could avoid plagiarism. And lastly, what you need to do when you're worried about plagiarism, cite everything. If you paraphrase a copy from somebody else, make sure you cite it. Then similarly verify it. Respect the limits. If you've been told 30%, it should be 30%. If you submit more than 30%, hata kwa first verification in RB haitaweza kupita. You need, but more important, we have to protect our career. As what you have seen, litigation can come anytime if you use a plagiarized work or if you submit a plagiarized work. I thought also I should add something on the use of AI in the write-up, because this is also a source of plagiarism if you're not careful. And nowadays, academic institutions as well as journals, they have included also a software to check whether this work is AI work or a human work. And if AI work is equally treated as a plagiarism, although it's not coming from a human work. So I'm not really saying completely don't use AI. There's a good use of AI in the write-up of scientific work, and there's a bad use of AI. Let's be responsible. Let's follow responsible use of artificial intelligence rather than just irresponsible use of AI. So I'm going just to focus a little bit on responsible use of AI. As what I said, there's many tools, and wala msindanganye kwamba hamtumii AI. We are aware of many work you do. It just comes from AI. As what I said, it has very good use on the AI, and there's many tools for the AI. Some of the institutions, they have even a guideline to detect the AI. MUHAS, I think they are developing the guideline. I'm not sure if they release it yet, but I think on the final stage, if not, the use of AI guidelines to the institutions. As what I said, it has very good benefit, but also bad one. You need to maintain the balance. Focus more on the good one and avoid the risk of the bad outcome for AI use. So every time you use AI, think to yourself, triage yourself, whether is it a good use or a bad use. I could advise avoid the bad use of AI. Focus on the good use. Yes? And there's a certain activities there between bad and good. What more important, if you are somewhere in between, please verify it. Please go through as a human, not submitting as it is of the AI. You need to verify. You need to rewrite it. If you made it by AI, I can say there's certain areas we need to just to recheck it. Yeah, this will be very important. And nowadays, they even need you to acknowledge if you have used AI. It's been acceptable to certain way. And if you have used AI in the good way, you still need to acknowledge that a certain section of I've used AI to improve the English grammar. It's acceptable. So the green zone, what are the good use of AI? Brainstorming of research, question or hypothesis, some literature they say use, it's good, but for dissertations, I don't think so, because most of the time it misses context. So maybe, although it's recommended from literature, but I could say, for you, start with your own hypothesis and not. If you write your background, AI could improve you for the grammar, for arrangement. That's okay, but you must start writing your own background and let the AI improve on that. Paraphrasing, I don't think you should really use to paraphrase to avoid anti-plagiarism. When I say paraphrase, just to improve your language. I know most of us, English is not the first language, and probably we haven't been with the yellow bus. Yeah? So maybe AI could improve your English. If you use it that way, could be a good way, but not to write your work for you. So as what you say, polishing your grammar, spelling, that AI could be a good use for that. And you allowed to acknowledge on that. The bad one, don't generate the entire section using AI. Let's say you tell the AI to write a background for you. That's bad. And if we detect it, it's plagiarism. So sometimes we tell the AI to write a data or to develop a table. It's plagiarism or it's a bad use of AI. To write up a reference you should write it yourself because you know this reference you must read it first and then you cite it and then you put in your bibliograph. So if you let AI do it for you means that even you didn't study these references, it's a bad use of AI. Try to paraphrase to bypass the plagiarisms is also bad use, but also translating for the language is bad use. So please, I just wanted to mention there's a bad use of AI, and we don't expect you to be in this bad use. If you do and be detected, you'll face the consequence I mentioned before. So what do you need to do? Most of the time, write your work. And if you write it independently, this is original work and it's good use, right? If it's you are not yours, Where did you cite? Is it from human or AI? If it is from human, it's okay. What you need is just to cite it. But if it's not your original work, it's not cited from source, it's AI until proven otherwise. This is the algorithm we use to detect, and we can realize this. Please have responsible use of AI. It's mandatory to disclose if you have used AI. Most, even the journals, they have this section for you to acknowledge. You can process all what you have. It's very bad to put in patient information on the AI. This AI, what you put there is not being deleted. Inabakia kwenye hiyo mifumo and can be retrieved anywhere else. So don't put somebody's name. Don't put somebody's information kwenye AI. Please, please, please. Mtakuja kufungwa. I just thought I should warn you from the beginning. Don't upload data on the AI. In analysis, don't use AI to analyze your data because they are not human and sometimes they are prone to so much errors, you'll fail to defend it. And this is a learning process, the analysis is a learning process. Do it with the approved software, the SPCSS, I don't know, the Strata, the RED. So all of these are there for you to learn so as you'll be able to analyze and understand your data. Don't use AI. The good use of supervisors can guide a lot regarding the AI. And some of the supervisors, they strictly ban the use of AI in the work, respect it. I just expressing the general concept within the word regarding the use of AI. Some institutions, they even allow their students to use it freely. They only have a guideline. MUHAS, we don't have a policy yet. So far, we don't allow the use of AI. If your supervisor say don't, please respect it. Or if your supervisor guide you, maybe we need now to paraphrase, go use. So every time you think about using AI, please discuss with your supervisors. As a department, we need it to be a responsible use for this. Remember the 30% and 6%. These are the bad use already mentioned. What I need to summarize here, I think time is almost half. There's a good and bad use of AI. I've already mentioned all of these. I don't need to repeat. I know you're adult, you know what I mean here. Before I end, what I wanted to say you that AI is a tool, not an author. It will not help you anyhow in writing your scientific work than just to improve what your work already done. Should not initiate to do your work. It should help to improve what you have. This is the responsible use of AI. Thank you. Again, let me allow to take comments, questions, or clarity from your side as well regarding plagiarism and AI use.
Thank you very much, Dr. Said. I have one concern regarding plagiarism. As you said, even taking your previous work or somebody's work, it's considered as a plagiarism. So let's take an example to those works which are not published, but were done. And you find something interested, you want to use it. How will you cite it so as it won't look good as a plagiarism?
With the citation, you can cite unpublished work. Because with your software of citations, you can add a scientific work manually to your reference manager. Let's say if you use, let's say, Zotero or Mendeley, usually we take it from online, yes, but some articles they're not online, that, for example, unpublished, we can add it manually to your reference manager and cite it using your reference manager. So it's okay to cite unpublished work, provided you follow the procedure to put in your reference manager and cite as what you did on a reference manager. So you're allowed, but you still have to follow the same procedures. Do you get me, madam?
Yes, doctor.
Yeah, most of these, even sometimes, unajaribu retrieve article from online to your reference manager. Sometimes haiji yote with all the details. Some of the detail you have to add manually. Maybe sometimes missing the name of the author. If you cite without missing of the author, now your reference will have no name of the author. So usually we upload to the reference manager. We cross-check it has all the details. If it's missing, then we have to add the detail before you cite it. Similarly, method you could use it to add and publish, provided umeicite, unataka kuicite, unaiadd kwenye reference manager alafu unaicite as is supposed to be. Any other questions? No? Yes, hauna swali tena?
Sina this time.
Good. Kimaro? Kimaro, upo? Kimaro si Kimario. Doreen? So you're telling me some people, they just sign in, they're not available. That's what the picture I get.
Nipo chief, lakini sina swali.